We're tracking the current measles outbreak in the U.S. as two states right next to ours are working to get dozens of cases under control.
Yeah, in Arizona, the Maricopa County Health Department telling us they are closely monitoring the situation and they're ready to respond if cases do start to rise here, like we've seen in New Mexico and Texas.
Right.
12 News journalist, you see Jen Wall is here now with more on this one. You spoke with health department officials here. What did they tell you about when we could possibly see cases here and how to protect ourselves?
Yeah, good morning to you both. So the Arizona Department of Health Services says there are no reported cases of measles in our state. And the Maricopa County Health Department added they are working with state and federal health partners to stay updated on any measles case developments. Now, I spoke with an ASU epidemiologist and professor who says she would not be surprised if cases started to pop up in Arizona because of our proximity to the outbreak states. However, she added it's difficult to know when we could see that happen. ASU's Megan Jean, who was on the front lines of Arizona's COVID response, says measles cases in West Texas and New Mexico, other nearby states, puts Arizona at risk. The CDC reporting more than 300 confirmed cases so far this year of one of the world's most contagious viruses. There have been 2 deaths, and the Maricopa County Department of Public Health says they have plans in place to quickly identify, investigate, and respond to any suspected measles cases. Jean says young, unvaccinated children are at highest risk. They're at risk of exposure through school and daycare. And Jean says measles cases rise about every 5 years, 2019 being the last big year for the virus. And the COVID pandemic could have slightly thrown off the timing from 2019 here to 2025.
It really comes down to the transmission dynamics of measles, how contagious it is, and sort of increasing susceptible population between outbreaks. So I think what we're probably seeing is this cyclical fluctuation in combination with some declining vaccination rates, which has just really set up this perfect storm.
So Jean says our vaccination rates are the worst they've been in 10 years. There's been a gradual decline in school-required vaccinations. Right now, there's about 90% coverage for the MMR, the measles vaccine, and experts want to see 95% to stop a measles outbreak. She points to vaccine hesitancy and the pandemic, missing doctor's appointments for that decline. And Jean says the public health system is working to increase those numbers. So the vaccination rates in 4 Arizona counties of greatest concern are lower than those seen at the epicenter of the outbreak in West Texas. That's according to ADHS data. Jean says the measles vaccine is about 95% effective. It provides long-lasting immunity, and symptoms of measles include fever, cough, runny nose, rash. So if you have any questions about exposure, symptoms, vaccinations, you can reach out to your medical provider. Now live in the studio, Jen Wall, 12 News Today in AZ.
All right, Jen, thank you so much.